today I'm going to be talking about lymphatic system care and conditions. First off, I'm going to describe what the lymphatic system is and what it does. So the lymphatic system is made up of vessels and nodes. The vessels will carry lymph fluid, which is just collected throughout the body through a one-way system into nodes, where it will eventually make its way to one of two specific ducts, the right lymphatic duct and the thoracic duct. From there, it is then returned to the bloodstream to continue circulation throughout the body. One of the most commonly seen conditions concerning the lymphatic system is lymphedema. Lymphedema is described as either too much fluid within the vessels or inability to transport this fluid. The best way to kind of describe those is too much fluid is similar to traffic on an interstate. When it's bumper to bumper, the fluid has nowhere to go and it either has to pull off onto other exits, which is basically the tissue surrounding the vessels, and then inability to transport can be from outside conditions, which I'll talk about in a later slide. So there's two types of lymphedema: primary, which is acquired at birth, and secondary, meaning it is secondary to another disease or complication. So surgery, cancer, chemo, therapy, infection, obesity, chronic venous insufficiency, and a lot more. So prevention is one of the main goals of physical therapy as far as the lymphatic system, because once lymphedema is acquired, it can be a long struggle financially, socially, psychologically. So if we can prevent it as long as possible or altogether, that's a big win for us. One of the main ways we do that is through staying healthy. That's easier said than done, but taking care of your skin can be a big one to prevent infections, making sure that cuts or breakdown of skin are covered, well taken care of, cleaned, etc. The next step, or the next prevention that we like to include, is exercise for patients. The body has a great natural way of using muscles to force the fluid in the lymph vessels back towards the heart to be circulated through the bloodstream. So any walking, jogging, leg exercises will be very beneficial for a patient with lymphedema or preventing lymphedema from becoming chronic. And the last one is, if you have something like cancer or trauma through a car crash or surgery that you can't really control, there are design products that you can use, whether wraps and garments, to kind of combat the predictable symptoms. So as I mentioned, there are ways such as cancer, trauma, or a car crash that you cannot prevent. And so if you do develop lymphedema, there are two main ways to kind of manage that as far as therapy goes. We can do compression wrapping, which is something we can do and we can teach you to do at home, and compression garments. These can be obtained a few ways. One is from a store like CVS, Walgreens, Rite Aid, Walmart, just purchased over the counter or off the shelf. They're generally a one-size-fits-all or based on a small, medium, and large. And then you can have one custom fit. This is usually prescribed by a physician or recommended from someone within therapy, and they can either fit you themselves, but usually they will have someone who is a specialist in lymphedema or a vendor for the products who will fit you and help you work through that. So now we're going to be using compression wrap that you can buy at a store like CVS or Walmart. And before we start, I always want to have the limb elevated, in this case her leg. I'm going to check for sensation, so if you'll close your eyes, can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Can you feel this?
No.
And what about this?
Mm-hmm.
Good. Okay, you can open your eyes. When I start, if it ever has plastic on the end of it, always tuck that to the outside. This one does not, so I'll just start on the top of the foot. You want to leave your toes exposed so you can check the color of them. If they're blue, purple, or black, you should undo it and rewrap it a little bit looser. When you start at the toes, always start tighter and then get looser as you work towards your knee, okay? So when you start, you can get one good wrap around. And you want to use about 50% of this material over what you've already put. Lift up right here. You want to make sure there's no wrinkles in it. If there are, just unroll it and wrap again. And you would proceed like this up the entire leg. When you finish, you want to use tape to try and hold it. Never use the metal tacks or brads, as they can cut the skin. And then whenever you finish, you can wear this around the house like normal, but it's best to keep it elevated so that any fluid and stuff will run down to your heart. And then if you do put this on, never fall asleep with it because you don't want to keep it on overnight. Any questions? Mm-hmm. And then we'll secure it with some tape. You can use as many as you need to securely hold it. I'm just going to put one on for the demonstration. Thank you so much for letting me work with you.
No problem.